Hello everyone, I'm Nicholas. I am a pharmacy practitioner. Thank you for joining me today. So today I want to walk you through what's new in the latest high blood pressure guidelines, okay? These guidelines are from the major heart organizations, and more importantly, I will also want to and most importantly, uh, this will help you to manage your blood pressure effectively, okay? So high blood pressure has no symptoms, yet it quietly affects your heart, your kidneys, even your brain, okay? So my goal today is to help you understand these changes in simple, practical ways so that you can take control of your health, okay? So don't worry, just let me know where you are watching me from and I will appreciate it, okay? So let us look at what's new and why it matters, okay? So one major change in blood pressure management is that nowadays doctors are encouraged to detect and treat high blood pressure earlier than before, okay? Yeah. So they have to detect it earlier just to prevent some damage that may come with it, okay? Because most adults, the recommended targets remain below 130 over 80, because even numbers that seem slightly high can, over time or for a long period of time or certain given time, can damage blood vessels and strain vital organs, okay? So these damages build silently for years before even showing up as heart disease, stroke, kidney failure, or even memory issues. That's brain damage, okay? So instead of using the one size fits all approach, clinicians now look at your full health picture. That is, I mean, by full health picture, I mean they look at your age, blood pressure, cholesterol, kidney function, diabetes status, your smoking history, that is if you are smoking, okay, and many more, okay? They may check your health profile, okay? So this helps to determine whether lifestyle changes alone are enough or whether medications may also be administered or be prescribed, okay? Because, okay, medications are needed for just to avoid the long-term risks, okay? The goal is treatment, not just to lower the numbers, okay? I hope I'm clear up to there. So our second point is how lifestyle and medication work together. It is recommended that you have to apply lifestyle first when the risk is low, okay? What do I mean that you have to apply lifestyle first when the risk is low? If your blood pressure is only slightly elevated and your overall risk is low, meaning the risk to maybe damage that come with the blood pressure, okay? The guidelines recommend starting with lifestyle changes for about 3 to 6 months, okay? Yeah, this includes the lifestyle that you're supposed to apply, eating a healthy, eating a heart healthy diet, such as the DASH diet. That's the dietary approach to stop hypertension. And also, eating healthy also means just putting in an effort to minimize consuming processed foods, okay? Please watch on that, okay? Other points on how to apply these lifestyle changes include reducing salt intake, okay? Remember, also salt comes with the processed foods. It's not only the table salt, okay? Increasing physical activity, managing your weight. If you are overweight, observe your weight, improving sleep, and also controlling stress, okay? So those are the lifestyle changes that the doctor may advise you if the your risk is low. So the changes don't just lower blood pressure, they improve energy, okay? They improve energy. They also improve your overall well-being, okay? But if blood pressure remains high or your risk is already elevated, in that situation, a medication is added or prescribed, okay? Some people may be started on combination pills just to control blood pressure faster and protect organ damage early, okay? Because medication is not a failure, okay? So if you are on medication, it's not a failure. It's a tool that prevents future complications while lifestyle habits continue in the background, okay? So just continue taking medication as you apply lifestyle changes. So let us discuss a little bit more about how blood pressure affects some of the major vital organs in your body, okay? This just to bring more emphasis on the need or the importance of managing your high blood pressure, okay? Please let me know where you're watching me from. If you're watching me live, thank you. And if you are watching me on replay, thank you. Please subscribe and let me know where you're watching me from. So the first one on our list is brain. You may ask, how does blood pressure affect brain health? How does it affect brain health? Here is how. High blood pressure damages those tiny vessels that supply your brain with oxygen and blood and other nutrients, okay? So high blood pressure may damage them. So over time, this can reduce oxygen and nutrient delivery, which may in turn increase risk of memory problems, okay? Cognitive decline, and even dementia. So control your blood pressures, okay? So controlling your blood pressure, especially keeping it below 130/80, does more than just preventing heart attacks, okay? It does more than just preventing heart attacks and strokes, okay? It goes further even to help preserve mental sharpness and independence as you age or rather grow older, okay? So just take care and observe your blood pressure. Keep checking your blood pressure, okay? So the second organ is the kidneys, okay? These are two main organs that are mostly affected by high blood pressure, okay? So the kidneys depend on healthy blood flow. So high blood pressure slowly scars their delicate filters, and once the kidney function declines, blood pressure often shoots up, okay? It shoots up. So when the blood pressure shoots up, this creates a dangerous circle in your body. So early and consistent blood pressure control can slow or even prevent long-term kidney damage, okay? That's why I emphasize that you keep monitoring your high blood pressure. Okay, I think it is important to say this. High blood pressure can also be detrimental to any pregnancy, okay? Yeah, because high blood pressure during pregnancy must be detected early and managed carefully, okay? Because doing so protects both the mother and the baby, okay? Which reduces the risks of complications and complication during delivery, okay? Sorry for during delivery, and also it lowers mother's future risks of heart disease or kidney disease, okay? Yeah, so I saw it good to mention this, even though I focus mainly on high blood pressure in seniors, okay? I just help seniors on how to manage their high blood pressure. So you can also advise someone who faces such an unfortunate scenario if they are close to you, even if they are not seniors, okay? Just let them know information is power and we'll move together, okay? So I have only focused my attention to brain and the kidneys because those are the main organs that are majorly affected by high blood pressure, okay? But generally, there's more damage beyond the kidney and the brain if you don't manage your blood pressure effectively, okay? So please, I beseech you again, monitor your high blood pressure, okay? Mostly if you are senior, 50 years and above, okay? Even if you're 40, keep monitoring your high blood pressure, okay? So after all this information, how do you apply this information in your life? Number one, know your numbers, okay? I mean, check your blood pressure regularly at home or in the clinic. That will help a lot. Number two, how to apply the information that I've shared, okay? Understand your risks. Ask your healthcare provider about your overall heart, brain, and kidney risks, okay? Not just the blood pressure readings, okay? Yeah, that will help you. The third one is act early, okay? Because lifestyle changes are most effective when started before extreme damage occurs, okay? Yeah, so act early. Point number 4, stick to your plan. Take prescribed medications consistently. Don't skip, don't have your own politics, okay? Monitor your readings also and follow up with your clinician if anything comes up. Okay. So we are almost done. This was a very short live. So if you're watching me live or on replay, let me know where you are watching me from, okay? I will really appreciate, okay? And please, if you don't mind, let me know your age group. The information will help me to create videos that fits you, okay? Yeah, if you give me your age group, where you come from, and what you may need, I'll create videos that are mostly targeted for you, okay? So before I conclude this live, I would appreciate it if you can let me know the following, okay? Just respond via the chat box, or if you are watching me on replay, type in the comment section, okay? And I'll be able to respond to you in time, okay? So help me know your concerns. If you let me know your concerns, you'll also be helping me. So here we go. I mean, the questions I request you to respond to, okay? So question number 1, do you know your current blood pressure numbers? And if you know them, or if you don't know, when was the last time you checked? If you know them, okay? Question number 2, has your doctor ever discussed your overall heart health or kidney risks, not just your blood pressure readings? Okay, if you're not getting anything, you can let me know so that I may repeat it. The other question, which lifestyle change is hardest for you? Is it reducing salt, exercising, or managing stress? Just note this question down so that you may respond to one. Even if you respond to one, I'll appreciate. Another question, if you're on medication, do you check your blood pressure at home to see how well it is working, or you just ignore it? Another question, were you aware that high blood pressure can affect memory and brain health? Did you know that? Another question, would you like a future session on natural blood pressure control, medication safety, or kidney health? Please let me know, okay? And I'll appreciate it. So just to close, let me just summarize. The new guidelines emphasize early action, okay? They also emphasize personalized care, and also they emphasize protective measures, not just protecting the heart, but also the kidneys and the brain, okay? High blood pressure may be silent, high blood pressure may be silent, but its effects are not, okay? The steps you take today, that is monitoring your numbers, improving your lifestyle, and following your treatment plan, they can really protect your health for many decades to come, okay? And please let me know where you're watching me from before I conclude once more. I just want to remind you that, okay? and I'll appreciate it. Also, let me know your age group. That will help me create more targeted videos for you, okay? And it will really be of benefit to you and also to me, so that we may grow together the channel, okay? If you've not subscribed to this channel, please subscribe, and I'll appreciate it. Not only subscribing, but if you find that this information is very beneficial to you, most likely it may also benefit someone else, okay? So please just share this information, and I'll appreciate it. Before I even go off, I've created so many videos in this channel, okay? So it will be good if you'll go and watch some of them and just comment on them, okay? It will also help, and it will help these videos to reach more people. Mostly, if you watch them, then share them, like, okay? Don't forget to like them, okay? Even this live, if you're watching live or you'll be watching it on replay, please just click the like button, and this video will reach more people, okay? So thank you so much for joining me today. If you join me in live, I appreciate it. But if you watch this video on replay, you're so welcome, and I'll appreciate it a lot for taking your most valuable time to join me, okay? I don't take it for granted. I appreciate it so much. I hope this information helps. I hope you now take care of your blood pressure based on what we have shared, okay? Thank you, and stay blessed. Let me know in the chat box or in the comment section what you think about that, okay? Thank you. And just respond to one question. I'll appreciate it. If you respond to only one of those questions that I've asked, it will really help, okay? And it will help many people. Thank you, and stay blessed. Bye.